Welcome to the EndoTool IV overview. This program will introduce you to the functionality of the EndoTool IV application. EndoTool IV is a clinical decision support system designed to provide insulin and carbohydrate dosing recommendations for the control of hyperglycemia. EndoTool calculates a patient-specific dosing model using the patient's diagnosis of diabetes, age, weight, active steroid dosing, renal function, and the patient's individual response to insulin. Specialty features allow for further modification of dosing by considering the presence of extracellular insulin. Patients who are being treated for either DKA or HHS, and clinical events known to impact insulin needs. There are 3 modes of therapy that can be utilized. The standard mode provides treatment in a selected goal range for hyperglycemia not specific to a hyperglycemic crisis state such as DKA or HHS. EndoX modes, utilized for DKA or HHS, provide treatment in a predetermined higher range and clinical advisory messaging that prompts the bedside clinician to change the patient's base fluid from saline to dextrose, and displays the criteria messaging for when to transition the patient to the lower range of control. Supplemental carbohydrate recommendations can be provided when the system calculates the patient's glucose trend will continue downward as a result of EREI, extra residual extracellular insulin. SKIP features provide oversight and clinical decision support advisories to improve compliance and avoid excursions during the evaluation period. Transition to EndoTool sub-Q is automated to maintain patient modeling between the EndoTool IV and EndoTool sub-Q applications. The system can also provide a hard copy recommendation for basal bolus correction specific to the patient's nutritional intake while on EndoTool IV. These recommendations are for use during the initial 24 hours after transition. Clinical events can be utilized to preemptively decrease either the dose or the model when a clinical event that is known to impact insulin needs has occurred. To illustrate the individualization of the recommendations, we will review the initial dose calculation for 4 different patient profiles. The common factor in these patients is the initial glucose of 300 milligrams per deciliter. Note that the other protocols provide essentially the same starting dose for all of these patients. EndoTool takes into consideration specific patient factors, which results in optimization of the first dose. After the initial model is calculated, the system determines dose adjustments based on specific patient response. For example, if the initial model for the patient calculated a dose of 18 units for a glucose of 300 milligrams per deciliter, and that patient's next glucose is 285 milligrams per deciliter, the system recognizes the response as inadequate, upregulates the physiologic dosing curve, and recommends a dose of 22 units. If, on the other hand, the patient response demonstrates an unexpected sensitivity to insulin, and the initial glucose drops from 300 to 200 milligrams per deciliter, the system downregulates the curve to match the patient's sensitivity and recommends 7 units. This adaptation occurs with each entry. EndoTool IV will provide recommendations for IV insulin infusion rate, IV boluses, supplemental carbohydrates, and hypoglycemia treatment. It is recommended when EndoTool IV is initiated that insulin not be added to TPN, oral agents for glucose control are canceled, and patients receiving oral intake are restricted to low-carb diets, and high sugar content fluids and snacks are avoided. The feature functionality and settings provided by EndoTool are determined by your clinical implementation team and approved by your medical director. The settings cover over 300 options that include goal ranges, treatment thresholds, content and display of clinical advisory statements and prompts, the criteria for the display of the stable message, and the options available for use when the patient transitions to subcutaneous dosing. EndoTool calculates and recommends the IV insulin or carbohydrates to achieve and maintain glucose control. When activated, specific modes of therapy can be employed to maintain the patient's glucose control at a higher range, thus assuring uninterrupted insulin infusion while the patient is being managed for either DKA or a hyperosmolar state. When these modes are in use, the system requires the user to respond to predetermined prompts for changes in the patient's therapy prior to allowing the glucose control to be dropped to the standard range, after which a notification is provided to the user when the glucose entry stabilizes and transition to sub-Q may be considered, if supported by the patient's clinical status. You may access the patient's EndoTool record from the patient's EMR link or via a link to the EndoTool dashboard provided by your IS team. Examples of EndoTool recommendations include infusion rate and bolus dose, D50 for IV treatment of hypoglycemia, and a carbohydrate recommendation to counterbalance the EREI for prevention of hypoglycemia. A choice of an IV or oral carbohydrate can be given. The history for the patient provides a chronologic review of both the recommended doses and the confirmed doses given. The history provides indicators for significant events or activities that impact insulin needs. These events are flagged, and the key to the flags is located at the bottom of the page. EndoTool responds to carbohydrate intake in two different ways. If the intake is in the form of rapidly metabolized carbohydrates like juice or an IV dextrose piggyback, the system will dose for the change in glucose, but will hold changes in the model. If the intake is in the form of complex carbohydrates like a meal, the system will provide dosing appropriate to the change in glucose, but hold model changes until after the meal has metabolized. A meal timer function is provided so that the user can be reminded that a glucose should be checked 30 minutes into a meal, and dose changes can be provided. There are 3 criteria that must be met for a patient to receive the glucose is stable advisory. The first 2 criteria are set by your medical director and include a standard deviation calculation that determines variability and a maximum allowable mean. Both of these criteria must be met within a minimum of 2.5 hours and a maximum of 8 hours. Once the system displays a stable message, the transition recommendation functionalities are accessible. A patient who has a stable glucose reading may not be clinically stable and therefore not yet ready for transition to subcutaneous dosing. It is always the decision of the provider as to when to transition patients to subcutaneous dosing. However, EndoTool will not provide recommendations for the transition if the criteria have not been met. The options that are available for use in transition have been set by your medical director. The user then selects the options ordered by the patient's physician. Once completed, the user can print a hard copy of the recommendations for approval and input into CPOE. It is important to note that if a patient's carbohydrate intake is expected to change after transition, the model provided by EndoTool must be adapted by the provider. Subcutaneous dosing should be evaluated daily in order to account for changes in patient condition and carbohydrate intake. This concludes our presentation. Thank you for viewing.